Introduction. The COVID-19 pandemic has wreaked havoc across the globe, causing immense health, social, and economic disruptions. As the world continues to battle the virus, scientists and public health experts are closely monitoring the emergence of new variants of the virus. In this exploration, we examine the possibility of future COVID variants and their potential impact on the ongoing fight against the pandemic. The evolution of COVID variants, viruses, including SARS-CoV-2, the virus that causes COVID-19, have a natural tendency to mutate over time. These mutational changes can give rise to new variants with different characteristics. Variants of concern, VOCs, are those identified to have certain properties, such as increased transmissibility, severity, or resistance to treatments or vaccines. Known COVID variants. Several COVID variants have already been identified and extensively studied. The Alpha variant, initially detected in the United Kingdom, demonstrated increased transmissibility. The Beta variant, first identified in South Africa, showed potential resistance to certain antibodies. The Delta variant, originating in India, quickly became the dominant strain due to its high transmissibility. Factors influencing the emergence of variants. Various factors contribute to the emergence of COVID variants. High transmission rates and sustained viral replication increase the likelihood of mutations. Lack of effective public health measures, including limited testing and contact tracing, can fuel the spread of variants. Additionally, selective pressure from treatments and vaccines can potentially lead to the emergence of viral strains resistant to these interventions. Impact on vaccines. The effectiveness of existing COVID vaccines against emerging variants is a matter of concern. While most vaccines, such as those based on mRNA technology, have shown good efficacy against known variants, there is a possibility that future variants could evade vaccine-induced immunity to some extent. Vaccine manufacturers and researchers are actively monitoring the situation and developing strategies to address emerging variants. Importance of surveillance. Monitoring the spread and evolution of COVID variants through genomic surveillance is crucial for an effective pandemic response. By analyzing viral genomes, scientists can identify and track variants, assess their characteristics, and inform public health strategies. Increased investment in genomic surveillance is essential to detect and respond to emerging variants promptly. Adapting public health strategies. As new variants emerge, public health strategies must adapt to mitigate their impact. This includes maintaining high vaccination rates, ensuring widespread access to vaccines, practicing effective infection prevention measures, and implementing targeted testing and contact tracing efforts. Flexibility in public health policies is crucial to respond effectively to the evolving threat of variants. The importance of global cooperation. Addressing the challenge of COVID variants requires global cooperation and collaboration. Sharing data, research findings, and resources across countries can help identify and respond to new variants more efficiently. International efforts should focus on equitable vaccine distribution, enhancing healthcare infrastructure, and supporting genomic surveillance capabilities in resource-limited settings. Remaining vigilant. While the development and spread of new COVID variants are concerning, it is important not to lose sight of the progress made in combating the pandemic. By remaining vigilant, adhering to public health guidelines, and prioritizing vaccination, we can minimize the risk posed by existing and future variants. Conclusion. The emergence of new COVID variants presents an ongoing challenge in the fight against the pandemic. The development of variants with increased transmissibility, resistance to treatments or vaccines, or other concerning characteristics highlights the need for continued surveillance, research, and adaptation of public health strategies. By remaining proactive and prioritizing global cooperation, we can better navigate the threat of variants and work towards bringing an end to the COVID-19 pandemic.